I love public health. Public health is community health at its base. It is the health of the whole community, the whole population together, as opposed to the individual health that we usually think about health to be. It's not about the individual. It's about the whole field of corn. When I plant corn, I want each stalk to be healthy, but ultimately, it's across the whole field that I'm going to do things to make that whole crop be healthy. And that's what public health is.
When public health works well, most people don't notice it. And as a result of that, it's hard to measure and monitor and even advocate for over long periods of time. And so when we do our work well, it's really almost invisible. It's hard to communicate that to folks who don't know much about public health. And it's also hard for folks who are in public health to kind of describe that to folks. How do you advocate for something that hasn't happened?
Very often, individuals think of public health as something that gets done to them, instead of something that gets done with them and for them.
I think when people think about health, they think about going to the doctor when they're sick. But in public health, we really try to prevent things before they happen. So working with the community to do education about if there's some kind of disease outbreak, whether it's COVID or the flu or STIs, and also just educating them about what health services are available in the community.
Our community was telling us that they were having a hard time keeping track of what are all the resources available to us. We don't know where to go for certain kinds of things. And so we're working on developing some interesting resources that will help people navigate that and find what they need online. And so they would be able to do that independently. And then that would be able to serve many people at the same time.
In the home visiting programs that I do, I see families prenatally through 2 years of age. And we promote things like a healthy pregnancy and prenatal care, and then postpartum care after birth, up until their child's 2 years old.
We offer vaccine clinics to prevent infectious disease outbreaks. We offer different safety clinics. We have specially trained car seat technicians that work to help make sure that families have their car seat installed properly in their car. It sounds like a simple thing, but actually it can be very complicated to make sure that everything is tightened and fits in just the right way so that we keep those little ones safe.
In our health department, we have about 7 different programs that help with public health. I specifically work in the food and lodging and pool program. Our main goal again is prevent disease and keep the public safe. So that's why public health and people like me in the community go and inspect those places, so when the general public is going to enjoy those places, it's going to be done in a safe way without getting any diseases. The thing that I enjoy the most is like try to trickle down the harsh language, the technicality of my job, and try to transmit that to a food worker, to a pool operator who is trying to figure out the chemistry of the pool, which can be very technical and very difficult to understand, but every subject you can just make it more colloquial, more friendly, more easy to understand. And for me, that's one of the things that I enjoy the most.
I think the beauty of a local public health department is we have people who are getting out in the community and talking to these families and seeing what they need and what the barriers are and how we can help them.
I often reference public health as the army, right, of the workforce. We're on the ground. Local public health is closest to the fire. We're in community developing those unique relationships.
I chose this path because I see the benefit of having a healthy community. As a health inspector, I always have to remind myself that all these steps that we make to be here today with clean air, clean water, lower amount of outbreaks, people not getting sick, and preventing all those things, that's what it get me going day by day and showing up for work. Because our work does make an impact in everybody else in the community.
My favorite part about public health is probably also the most challenging part. It doesn't come in a specific recipe that we follow, and if you do this and do that, then you'll get this. We have to innovate and create and problem solve and get deep into community and work with people and work at all different kinds of levels. So every day is a new day and a new challenge for us.